Eric Lanask. I'm here at Cloud Expo in New York City. Joining me today is Andrew Morawski from Vodafone. Andrew, great to have you with us.
Thanks, Eric. I appreciate it.
So, a company like Vodafone, you've got your hands in an awful lot of projects, I imagine. What are some of the big things that you're working on right now?
Well, look, at Vodafone, we've got specialists across a whole lot of industries. We're doing big things in automotive, big things in the utility space, smart grids. But one of the things we're here today talking about is healthcare. Right, and it's a very complex ecosystem to understand. We're giving a presentation this afternoon that's going to talk a bit about some of the specific customer opportunities that we've had and we've worked through in the industry, and what our expertise really is in this space.
What are some of the developments as far as technological developments that are taking place around healthcare?
Well, actually, that's one of the interesting things about the presentation today that I'll be giving is I'll be speaking about the transformative power of IoT in healthcare. And it's interesting as well because conversely, I think healthcare has a unique opportunity to show the true benefits of IoT, unlike, kind of a connected smoke detector or anything like that. There's true benefits being brought to people and people's lives.
Can you talk about some of those benefits?
Yeah, sure. So, look, the whole healthcare industry is transforming, but I think the key benefits that we're starting to bring to the table with IoT are, bringing the point of care closer to the patient, right? Reducing stress on the healthcare system by having more outpatient services available, more remote diagnostics, and things like that.
And I have to believe that we've all been patients at one time or another. Being able to do some of those things from the comfort of your own home, there's a huge comfort factor and makes it easier for the patient to handle those scenarios.
Oh, it certainly is. One of the projects we've worked on was with Boston Scientific for their for their Latitude project. Now this is it's a cardio monitor implant, where we've actually put an embedded SIM into their device that sits on a nightstand and manages and monitors the patient's vitals. So they can tell in advance if there's any trouble, a lot of times even before the patient knows.
Certainly the benefits are easy to figure out. Are there any dangers with having effectively the body connected like that?
Yeah, look. So the two biggest things, biggest obstacles for people stepping into this space in healthcare, obviously, is patient safety is the first one. But the amount of regulatory work that's happening from an FDA perspective to keep patients safe is it takes at least 12 months to go through the cycle to approve it. One of the problems that our customers run into is that technology moves so much faster than the regulation does, right? So they then struggle to keep pace with the changes in technology. But the other big concern outside of safety is patient data information, right? Patient privacy. So those are the two big hurdles that our customers have been facing.
Those two obstacles or those two hurdles are going to be pretty consistent across any kind of solution or any kind of technological innovation. Are there specific use cases that you're seeing or that you can talk about?
Yeah, so the first one I mentioned, the Boston Scientific one, but the second one, we've done an interesting piece of work with a company called Lively based out in California. It's for elder care. For elder care monitoring, and that, again, similar situation where they embed a Vodafone SIM into an in-home hub, where they simple out of the box ship to the senior. They plug it in, and they've got instant connectivity right off the bat, and you place sensors around the home, right? So loved ones or even doctors can pay attention to what's happening in that patient's household, and also they've got an alert bracelet that they wear with it as well. So the number of use cases are endless. In healthcare specifically, there are so many benefits that we're starting to bring to the market with IoT.
How does the monetization work? I mean, who pays for this stuff then?
Well, and that's one of the complex things about healthcare. So, a lot of times my customers aren't even using my service. Their customers are not even necessarily paying them for the service that they're using, but a third party is paying for and evaluating the services in a lot of instances. So it's a very, very complex environment, and there is a lot of opportunity. As you see, so many entrants stepping into the space, a lot of opportunity for people to make money in this space.
As you say, there are a lot of entrants, a lot of opportunity. how is Vodafone going to continue to differentiate its services and the opportunity it delivers?
Look, we've been at the forefront of innovation, like I said before, across a whole series of industries. I think we're going to just continue to press down that path, continue to move ourselves further up the value chain. And again, the key to our success so far has been focusing on use cases with practical applications that bring benefits to people, right? As opposed to kind of the pie in the sky. Yes, it's great for your air conditioning to turn on as you pull into your driveway, but that's not going to change anyone's lives, right? So that's why we focus on the areas of IoT that really have an impact.
So how do you determine which applications or which potential applications are the ones that, from an end user, from the patient perspective, when we're talking about healthcare, are really going to have an impact, are really going to see significant adoption?
Yeah, I think the ones that transform the way things happen are the ones that we give the biggest priority to. So yes, elder care, the example I mentioned before, is great because it gives someone a sense of security. But if you're talking about point of treatment, and if you see an ambulance pulls up to someone's house and you're starting to do tests and information on the way, on your way to the hospital. If you can get that information to the hospital before you actually get there and get a jump start on care, those are the kind of things we try to focus on, things that change the way that things happen.
How long until we add driverless ambulances to the mix?
If it's up to some people, it would be immediate, but I think it's going to be a little ways away still for that.
Andrew, thank you so much. Good luck going forward. It's been a pleasure having you.
Yeah, great. It was really good to be here. Thanks, Eric.